Well, good morning, everyone. We remain focused on improving healthcare across the province, and I'm pleased to be joined by my Minister of Health, Adriana LaGrange, and President of the Nurse Practitioner Association of Alberta, Jennifer Mador, to talk about another important step forward. Today's announcement builds on one that we made last November when we announced that we would be establishing the Nurse Practitioner Primary Care Program. We know that too many Albertans do not have access to a primary care practitioner, and often when they are able to find a healthcare provider, they still need to wait weeks to get an appointment. That's just unacceptable. So we created the Nurse Practitioner Program to provide Albertans with greater access to primary care. It's part of our larger efforts to stabilize, strengthen, and improve Alberta's primary healthcare system. Today, that program is not just an idea or a plan, it's in place. Nurse practitioners are a welcome and integral part of the solution to primary care access. They are qualified healthcare professionals whose education and training allow them to function as primary care providers and offer many of the same services as doctors. However, Alberta hasn't had a direct funding model that allows nurse practitioners to work autonomously in a primary care environment, have their own practices, until now. Through the new program, Alberta's government will compensate these highly trained, highly valued medical professionals to practice patient care and provide the health care they are qualified to do. That means that nurse practitioners will be able to open their own clinics, take on patients, and offer services that reflect the full extent of their training, skills, and experience. As announced in October, we have provided the Nurse Practitioner Association of Alberta with a $2 million grant over the next 3 years. This funding will enable the association to help nurse practitioners fill out applications, recruit staff, and plan their work. That could be setting up and managing their own team-based clinics or practicing independently in an existing setting with a team that's already established. Expressions of interest are now open for nurse practitioners interested in independent practice. And I would like to note that in this program, nurse practitioners will start with a minimum panel of 900 patients. This reflects a reasonable amount of patients for a full-time practice. I've said it before, Alberta's government is pulling out all the stops to stabilize, strengthen, and improve Alberta's primary healthcare system so everyone can access care when and when they need it. I truly appreciate that the Nurse Practitioners Association of Alberta and their members are willing to roll up their sleeves to work with the government on this critical work. This is an exciting step forward in our journey to refocus the healthcare system and expand primary healthcare. Certainly, there is much more work to be done, but make no mistake, we are on our way. Now I'll turn things over to Minister Adriana LaGrange for more details.
Thank you, Premier, and good morning to everyone. It is wonderful to be here once again to talk about how Alberta's government is taking concrete action to improve primary health care across the province. Over the past 5 months, we have been consulting extensively with the Nurse Practitioner Association of Alberta to develop a new nurse practitioner program that would expand opportunities for nurse practitioners and to provide Albertans with greater access to regular primary care providers when and where they need one. While it took a bit longer than we wanted it to, we wanted to make sure we got it right. And we wanted a program that will encourage nurse practitioners to practice and participate, and that will be sustainable in the long run, and also that will meet the primary care needs of Albertans. So we made sure that we worked really, really diligently on this program, and I want to thank Jennifer and her team for all that they did. I believe the model we are announcing today will do just that. Through the Nurse Practitioner Primary Care Program, nurse practitioners will practice comprehensive primary care autonomously and operate their own practices or join existing primary care clinics. We will compensate nurse practitioners approximately 80% of what a family physician would provide who provides comprehensive primary care is paid. Compensation will be based on the number of patients they have or their panel size. The minimum panel size is 900 patients, and nurse practitioners will have 2 years to reach that number. We've structured the program to incentivize higher patient attachment, with compensation increasing as their panel size grows. Criteria for the program includes committing to provide medically necessary primary care services, providing after-hour access on weekends, evenings, or holidays, and providing a certain number of clinical hours and providing walk-in appointments while nurse practitioners build up their panel size to 900 patients. We want this program to be successful, so we are providing numerous incentives and supports for nurse practitioners to take part. They are eligible for the Panel Management Support Program that provides funding to help primary health care providers manage an increasing number of patients. Each provider has the potential to receive up to $10,000 annually. They are also eligible for the Rural, Remote and Northern Program that provides funding as an incentive to practice in rural areas, similar to the program that rural physicians access. Nurse practitioners will also receive a one-time incentive payment of $75 for each additional patient once nurse practitioners reach a panel size of 900. That funding will be distributed until the $2 million that has been allocated for the panel growth incentive this year has been reached. In addition, clinics, communities, and primary care networks can partner with nurse practitioners who are just starting to practice by applying for one-time mentorship funding. Through this mentorship funding, there is $10,000 available for mentors during each nurse practitioner's first 18 months to ensure a successful transition to full practice. First Nation communities, Indigenous clinics, and other Indigenous organizations can also submit joint applications with a nurse practitioner to help them increase their panel size, help with administrative costs, and provide wraparound services. While we don't yet know what the uptake will be, we anticipate that up to 50 nurse practitioners may participate in the Nurse Practitioner Primary Care Program this year. This means that once the program is fully implemented, they will be able to serve at minimum approximately 45,000 patients, which is an amazing number and will go a long way to address current access issues. The program will operate for a minimum of 5 years, subject to regular reviews and adjustments to meet evolving primary healthcare needs of Albertans. An audit function will ensure compliance with program parameters, enhancing accountability. And I firmly believe that the Nurse Practitioner Primary Care Program is great news for Albertans and great news for the primary healthcare system overall. It will add more health capacity in communities across the province. It will give Albertans more access to a regular primary care provider who they can develop a long-term relationship with. And it will help take pressure off the rest of the healthcare system. Supporting nurse practitioners to do more of the work that they are trained to do is another tool we'll use to stabilize and strengthen primary healthcare throughout Alberta. And before I close, I want to thank the former president of the Nurse Practitioner Association of Alberta, Dr. Susan Pendergast, as well as the current president, Jennifer Mador, for all of their hard work in getting us to this day. The association will be using a $2 million grant that we are giving them over the next 3 years to help nurse practitioners throughout the application process, to recruit more nurse practitioners to participate in the program, and to support them as they plan to work independently. To all the nurse practitioners throughout the province, thank you. Thank you for all the tremendous hard work that you do each and every day serving Albertans. It is greatly appreciated, and the expression of interest process is now open. So I encourage every nurse practitioner to go online and read through the materials. I think you will find it interesting, and I hope that some of you will be looking seriously to apply for it. So again, thank you so very much. And I will now invite Jennifer Mador to come and say a few words.
Thank you, Premier Smith and Minister LaGrange. Nurse practitioners bring high value to the healthcare system, and thank you for recognizing that. With over 700,000 Albertans without a primary care provider and over 900 nurse practitioners in Alberta, there is real opportunity here to significantly decrease the lack of access. Direct reimbursement that was announced today is the right next step forward in the marathon towards modernizing compensation for nurse practitioners. This removes obstacles to care by allowing the flexible integration of the only other primary care provider that can provide comprehensive longitudinal primary care. Family physicians are a scarce resource, unfortunately. The current supply of physicians in family medicine cannot do the demand alone. We are working towards a team-based model of care, and we look forward to working with our physician colleagues in addressing the healthcare deficits. It'll take the whole team, including registered nurses, pharmacists, physios, social workers, paramedics, and many others in order to provide wraparound primary care services, and we look forward to working with all members of the team to address Albertans' needs. We have to remove the current obstacles and barriers that allow us to get to work for Albertans. Across the country, nurse practitioners have been implemented in primary care for many years. Since 1970, every national level health report has recommended the full integration of nurse practitioners as an efficient, effective, and necessary role in primary care. The limitation that was addressed today is funding, and that sustainable funding is now being removed as the obstacle. Thank you, Premier and Minister, for taking the first right step in removing this barrier through the implementation of direct reimbursement. It means that NPs will now be enabled to access funding to open their own clinics or join existing clinics. This will help offset overhead costs and the workload that our physician colleagues are currently experiencing. We look forward to working with them. It will allow them to lead multidisciplinary teams and to direct care and resources that are specific to the communities that they serve. But most of all, it provides patients to expert primary care services by one of the most researched health professionals in the last 50 years. NPs are shown to provide excellent health care, address complex medical needs, and provide excellent patient-centered care. Rest assured, nurse practitioners will be able to provide all primary care services that Albertans need. It is this blending of nursing and biomedical model training that enables nurse practitioners to be the only other option that is immediately available for the primary care demands of today and tomorrow. This new compensation model is new for nurse practitioners. There will be some growing pains, but I'm excited for the potential that this new model provides. We have a collaborative, good working relationship with Alberta Health, and I expect that we can ensure the funding is reflective of nurse practitioners' expertise, training, the medical liability that they take on, and will counter the systemic disadvantages that currently exist for NPs opening a small business. Together with Alberta Health, we will address removing any other legislative or regulatory barriers that limit patient access to full-scope NP care. I look forward to continuing this work with the Minister's office and ensure success of these small businesses to ensure their viability and purpose for improving access to primary care services for Albertans. Thank you.
And with that, we'll go into the media Q&A. We'll start off with questions here in the room. Reminder for one question, one follow-up. We'll start with Catherine, then Brianna, then Jonathan.
Okay, so Catherine Grafkowski, Alberta Today. I'm trying to understand the math here because we have physicians who say they aren't sure whether to close their practice and go full-time to the hospital. They have all this overhead, rent. There's so much cost to running a clinic, and you're saying nurse practitioners get 80%-ish of that compensation. So how's that going to work? Like, are they going to be drawn from the hospitals in order to make enough money to run their clinics, or how do you see the math working out?
Well, so what I think you're referring to is the fact that the doctors, our family physicians and our rural generalists have very complex funding models. And it's the reason why we worked very closely with the Alberta Medical Association to address those issues. It's why last week or the week before we made the announcement on the new funding model framework, and that we're going to go to rate review committee. It is very complex for family doctors and rural generalists and the physicians in general. There's fee-for-service, there's ARPs, there's blended capitation models. They can choose from which ones work best for them. So what we're looking to do here is really make sure that the nurse practitioners have a model that is sustainable, that allows them to do the great work that they're able to do, take on their own patients. It's the first of its kind in Canada, is my understanding. So we're leading the way nationally for nurse practitioners to be able to do that work.
And yesterday, when we were talking about that audit, there's some clinics that are charging membership fees. I'm wondering how many of those clinics may be nurse practitioners who would love to be able to have billing codes but have no choice but to charge patients.
Well,
That's what we're fixing with this.
yeah, that's what we're looking to fix with this, because of the fact that nurse practitioners to date have not been able to take on panels without charging fees. So
How many?
on the 40, she's talking about the medical clinics, so I'm not sure how many of those are nurse practitioner. I don't know if you know any of those clinics that are out there or how many there are. Do you?
I don't have a specific number, but there
We
are
might
some
need
that
you
are.
to come to the
Oh, sorry.
Oh, sorry.
Sorry. There are a few out there, and they have no other option other than to provide what's needed in their current communities. I don't have a specific number for you.
And we'll go to Brianna.
But as far as the clinics that we are investigating and making sure that we can look at, we are wanting to make sure that those that are providing services or providing those memberships are not charging for insured services. That is very clear. That's not allowed, and we are making sure that that does not happen.
Premier, today after seeing the letter that was sent to your Municipal Affairs Minister, City Councillors in the City of Edmonton are asking you to apologize for speaking about it before you even received the letter. Will you be issuing that apology?
Well, I hope the reporter who asked me the question apologizes for asking me the question.
I didn't ask you specifically about the letter, though. We didn't know about it. I asked if you had received any reports of these sorts of issues.
I will tell you,
didn't receive the letter. You
I will
didn't have to
tell
say
the
that we received-
reporter who asked me the question what my answer was that day, because I was doing a task force announcement on funding for Ukrainian evacuees, and I said, I would say I've heard that a letter is coming in to the Minister of Municipal Affairs. I've not seen that letter, but I would maybe direct you to the Minister of Municipal Affairs to see what his comment is on that. When pressed by the reporter, I further said, look, I mean, I don't want to prejudge what may or may not be in a letter that we've been told we will receive, and so I just wouldn't mind seeing the letter, talking to my Municipal Affairs Minister, and seeing if there's anything more that we need to do. But at the moment, I've not seen the letter. We've not received it yet. I've just been told it's on the way. I would just say that I don't want to mischaracterize it because I don't know the details. So I'd rather just wait and see what the letter says. The letter came in. The Minister of Municipal Affairs reviewed it, and he forwarded it to the Integrity Commissioner. And you can ask further questions to the Integrity Commissioner.
And my question was, did you receive any reports about X? You hadn't at that point, so you could have just said no.
Okay. No.
And we'll go to Jonathan.
Okay, Jonathan Bradley, Western Standard. So this compensation model is for 80% of funding. How is that number determined?
Do you want to go? Sure. Sorry. So we looked at, the compensation that family practitioners and rural generalists are getting, and determined, by the scope of what nurse practitioners are doing, that, roughly 80% of what a physician can do is roughly what a nurse practitioner will be doing. That being said, I know that they do so much more, but we also know that doctors can do surgery. They go into hospitals. They have some demands on them that are not demands that nurse practitioners have. So that's where we came. We have a robust, what I would call a robust assessment of this program that we will be implementing at 18 months and then again at a further time point a couple of times within the program to really look at that and make sure that we're getting it right. So it will be a collaboration, as it has been all along, to determine have we got it right and what needs to change in the future.
Okay, and with that being said, obviously there's healthcare labor shortages with the number across all sectors, including nurse practitioners. What will you be doing to recruit nurse practitioners from other provinces and convince them to come to Alberta to work?
Well, the fact that we have the ability for nurse practitioners to actually have a new funding model that does not exist anywhere in Canada, that is exciting and new. I think Jennifer can speak to this a little bit more. I think that's very attractive. We certainly want to retain the nurse practitioners that we do have, and we are continuing through the College of Nurses look at how we can attract more nurses. We have been able to. I believe the number is about 4,700 nurses overall to the province in the last year alone. And we know that with a growing population, great news for us that we're growing as a population, but we do need more across the province. And maybe Jennifer could actually speak to the excitement that she's hearing from her colleagues across Canada.
Thank you. When the Nurse Practitioner Association did a scoping review of Canada, most of the funding models that exist have to flow through primary care networks or other government institutions. This is the first direct funding model that mirrors what our physician colleagues have had. It allows flexibility for our ability to have more of an entrepreneurial relationship and model where now these nurse practitioners can open and run their own clinics. So that's novel. And everybody across Canada has been mentioning this to me as something that they're looking to modernize their primary care healthcare system, including nurse practitioners.
Thank you.
Yes,
Thanks, Jonathan. And we'll go over to the phones now. Operator, can you put through our first caller, please?
Lauren, CBC. Hi. So I guess my question would be for Minister LaGrange. According to the most recent data from the Canadian Institute of Health in 2022, there was about over 600 NPs in the province, and of that number, almost half were in hospital settings. So are you concerned at all that some of those nurse practitioners might be moving from hospitals to clinic, and isn't that just moving the problem around?
Well, we're now over, from the numbers that you have, we're over 900 nurse practitioners in the province. I do know that there are nurse practitioners that specialize, whether it's in oncology or other specialty areas. My understanding, having spoken to a number of them just recently, that they would continue providing the services that they provide, but they love the opportunity for other nurse practitioners who want to practice in comprehensive longitudinal family care. They want to have that type of a practice, that this allows them that flexibility to do that. So I don't think that we'll see a mass exodus out of facility care for nurse practitioners, but this does allow for additional options. And I believe that's what, Jennifer, you've been hearing as well.
Yeah, okay. And my follow-up question would be maybe for Jennifer regarding the nurse practitioners. Like most nurses are female, so do you think that's going to make it easier for female patients that want to access a healthcare provider that is the same gender as they are? Some women want the same gender for healthcare providers. So do you think that make it easier for women in the province?
Absolutely, yes.
Thank you, Laurence. And operator, could you put through our next caller, please?
Kendra Silowski, Global News.
Hi, this question is for the minister. I'm wondering if you could please tell us more about potential measles exposure in Edmonton, specifically in healthcare settings, the Stollery Children's Hospital, the seriousness of this. Thank you.
Thank you. We were made aware of a child that had been traveling and who had contracted measles and who has, yes, been to the Stollery. So I know that Dr. Jaffe, our CMOH, and Public Health is making sure that those who may have come in contact with this child has awareness of it in case they need to take additional action.
Thank you. And can you still hear me?
Yes.
I just wanted to follow up on nurse practitioners. We've heard from some medical clinics that are closing, saying they can't afford under the fee structure to pay for their rent. So after this one-time fee runs out with the nurse practitioners, how will they be able to run a clinic when we're seeing these overhead cost concerns?
Well, the administrative costs are built into the funding model for nurse practitioners, just as they are also accessible to family physicians and rural generalists. So they, as I said earlier, their funding model is very complex. It's the reason why we've added additional funding to stabilize primary care physicians in the province. It's why that was over $200 million, up and above the negotiated contract of $789 million over 4 years. Plus, we've added the $57 million in panel management, and we've gone on and on just to make sure that we can, in fact, stabilize family medicine while we are looking towards this new funding model for family practitioners, for doctors that practice the comprehensive family care. So there has been a lot of effort made to make sure that physicians have access to it, but ultimately physicians are autonomous and they can make decisions in the best interest of their own businesses, and they have that ability.
Thank you, Kendra. Operator, can you put through our next caller, please?
Jennifer Lee, CBC.
Hi, thanks for taking my question. Minister, I just wanted to get back to the measles case. I'd like to get a sense from you in terms of your level of concern, and perhaps you can outline specifically what steps public health is taking to ensure that outbreaks don't happen like we've seen in other jurisdictions, particularly given, you know, some of the concerns over vaccination rates. So if you just outline some specific steps that are being taken now that this case has been identified.
Right. And again, this is only the second case that we've seen in about 6 months or so. Both of them were contracted through travel. And the public health officials are, in fact, making sure that they get the message out to anyone who may be affected by this may have come in contact with this particular child and may have been exposed. We continue to put forward the messaging, particularly to families that are traveling, to make sure that you do have your vaccinations up for measles and some of the other illnesses that are, in fact, seeing a resurgence across the globe. So we continue to do everything we can to make sure that that news gets out there.
And I just have a question for Jennifer regarding this announcement, if possible. What are you hearing from your nurse practitioner colleagues regarding this announcement, this step? You mentioned there are other obstacles. So what are those that you want to address moving forward? And do you think this funding model is sustainable in terms of opening a practice, operating one in the long term?
So we had a special membership meeting last night, and the overall feeling was that this is an excellent first step to building this relationship. These are expert primary care providers who have sought out ways to provide care. They have been doing this work for quite a few years under the PCN model. Some have gone private in order to provide care. This now offers them an alternative model. They do not need to do this independently outside of other multidisciplinary clinics. They can certainly join clinics or collaborate with others in order to sustain the overhead, as we know that it is challenging, but it is built into the system. And as new business owners, the NPA will be supporting any nurse practitioner that goes into this publicly funded model, along with Alberta Health, to ensure it's sustainable and viable for the future.
Thank you, Jennifer. Operator, did we have any more callers in the queue?
There are no other questions in the queue at this time.
Thank you. That'll conclude today's press conference.
Thanks, Jennifer.